Drug overdoses skyrocketing. States and the federal government are looking for new ways to tackle the crisis. Overdose deaths surpassed 100,000 during the 12-month period ending April of 2021. That is up 28% from the year prior. The cause, synthetic opioids, primarily fentanyl. Customs and Border Protection says that most fentanyl arrives in the U.S. through ports of entry along the southwest border in cars and commercial trucks. Lilia Luciano got an exclusive look at new federal government technology and spoke to a parent who's trying to make a difference.
Right in here is where his ashes reside. I come here every morning and I kiss this box, and I kiss it at night before I go to bed.
Jaime Puerta's son, Daniel, was 16 when he died in 2020.
When I opened the door to his room on April the 1st, I saw my son lying with his arms across his chest. His eyes were slit. He was ashen gray, and he had a blue tint on top of his lip. And I just started screaming from the top of my lungs, "Daniel, Daniel, Daniel."
Near his son was half of what looked like a blue oxycodone pill, which Puerta says Daniel bought from a dealer on social media. He was told his son had overdosed.
And I said, "An overdose?" I go, "Well, what did he overdose on?" The pill that he had ingested was pure fentanyl. This is not an overdose. This is a poisoning.
This is an entirely different drug.
This is an entirely different drug that my son had absolutely no idea what he was taking.
Daniel had struggled with substance use and mental health in the past, but his dad says he wasn't addicted to pain pills. Puerta says the way fentanyl has transformed the drug landscape urges a new conversation around drugs in which there's little to no space for curiosity or experimentation.
The consumption of any kind of illicit narcotic is like playing Russian roulette with a loaded gun, because you don't know if it's going to take your life.
2021 was the deadliest year for overdoses in the U.S. Since 2018, the DEA has seen more than a 50-fold increase in the number of counterfeit fentanyl pills seized, and those containing a lethal dose increased dramatically.
When teenagers attempt to purchase the prescription drugs on the black market, more often than not, they are sold fentanyl colored, sized, and stamped to look identical to the prescription drug.
From 2014 to 2019, China was the leading source of illegal fentanyl. Since then, Mexico tops the list. And while seizures of cocaine, meth, and heroin by Customs and Border Protection have decreased in recent months, fentanyl continues to go up. It's more addicting and powerful than other drugs, and that makes it better business in the black market. At the Brownsville, Texas port of entry, stopping the rising flow of it is a constantly evolving task.
How bad is it right now?
It's just very challenging at times. It can be very challenging.
So here we see the driver.
CBP Director Tater Ortiz gave us an inside look into the agency's high-tech efforts.
This is the latest and most powerful technology that Customs and Border Protection is using at ports of entry to take photos, x-rays, and detect any kind of smuggled goods or people across the border. They believe it will help curb the national fentanyl crisis. How many are going through the x-ray?
We're doing approximately 70-80% is being scanned and adjudicated right now.
What was that number in the past?
We were in the low 20s.
Oh, wow.
Brownsville is one of at least 2 ports of entry using this new technology so far, 2 out of 328 nationwide. But the federal government hopes to expand it further.
This equipment we call pre-primary, before the trailer actually meets the officer, so we have time to adjudicate it before it even arrives to us, which allows us time to adjudicate the image and speeds the process up.
It's more efficient because, before you have that interaction with the officer can better target who needs to have that interaction.
Yes, we now know what's in that trailer already. Not just based on the manifest, but now we have an actual image to marry it up with.
Jaime Puerta can't fight the supply of drugs, but he started a foundation to educate teens and parents, hoping awareness in the classroom and at home can help save lives.
We're not going to arrest our way out of this. Education is key. We have to get the education into our high schools, even if it scares them.
And where do you find solace?
I find solace knowing that my son is in a much better place than I am, and that he will be waiting for me when it's my time to go. And that he could say, "Dad, you did good in my name. You did your best. I saw you trying to save lives. I'm proud of you, Dad."
Part of Puerta's advocacy is now awakening people to the ways that fentanyl has transformed the entire drug landscape and how it's now not just impacting addicts, but experienced recreational drug users, curious teens, anyone taking a drug from the black market. I asked him, well, there's decades of data that shows that Just Say No campaigns, the ones from the past, have not worked. So what's your message? He said, look, the way things are now, especially for young people who don't have access to drug testing strips or safe injection sites or things like that, don't do drugs is all he can really come with.
Yeah, well.
You said it was going to be a very powerful ending, but that was a whole different level. Yeah. And let's not miss the point that he's making. I love when he said we cannot arrest a way out of this situation. No. These kids don't know what they're doing.
No.
They don't know. He says, my son was not overdosed. My son was poisoned.
Because the reality
it's a big difference.
It's so strong. One experimentation, one effort can be the last one.
Yeah. And it's on everything. It's on cocaine, it's on heroin, it's on pills, and the pills are counterfeit.
He makes a great point that education needs to go into the schools.
Exactly.
Because that's where these drugs are finding their way into.
Yeah. It's good to see you in person.
Great to see you.
It's so good to be with you all and finally meet you in person.
Please come back more often.
Oh, I will.
And bring your name, Lilia Luciano.
Lilia,
I say you have the best name on television.
That's
Kudos
right.
to your mom.
Rolls right off the tongue.
It
it's
does.
the same as my mom, so she loves to hear it.
Well, shout out to your mom.
Thank you.
All right.